So, MJ is an 85-year-old male admitted on December 3rd. He has a history of bladder cancer and he is currently receiving radiation and chemotherapy. He was admitted with hematuria and clotting in his chronic Foley catheter. He is a DNI, but otherwise he's stable and he's oriented ×4. He is on room air and out of bed. He is on a regular diet and he's tolerating that well. He has a significant medical history, including bladder cancer, hypertension, hyperlipidemia, congestive heart failure, and coronary artery disease. Regarding his current condition, his chronic Foley catheter was exchanged on admission. He's got a 16 French Foley. He's passing blood clots through the catheter, and his flow is good right now. On admission, the urology indicated the Foley will need to be changed in a month, unless necessary, otherwise, like if it becomes infected or something. He is being treated with the antibiotic ertapenem once every 24 hours, and that's for the infection or to prevent infection. He has 2 IV access sites, a 20 gauge in the right AC and a 20 gauge in the left forearm, both of which are patent. Lab work includes hemoglobin, hematocrit every 6 hours. His urine right now, it's you can see it's red. It's visibly red. Let's see. Right now, his Foley catheter is functioning with a little bit of blood and clots passing through, but it's flowing. He's got no signs of obstruction right now, but he's at risk for clotting. He is hemodynamically stable. His last set of vitals were good. His blood pressure was 128/72. Heart rate was 86. His respiratory rate 18. O2 saturation was 97% on room air. He's got no signs of respiratory distress. His Foley site shows no signs of infection, and his IVs are intact with no redness or swelling. He's been compliant with his medication regimen, and he appears to be, his energy levels are appropriate for his condition. And he's able to get out of bed as needed. I recommend monitoring the Foley catheter closely for any kind of obstruction. If it clogs, you should you manually irrigate it with 60 mLs of NS as per urology instructions. Monitor hemoglobin and hematocrit every 6 hours to his hematuria might get worse and increase the risk for anemia. Continue administering his ertapenem as scheduled. Check for signs of infection around the Foley catheter and the IV sites. Maintain his diet, his regular diet, unless it's changed. Report any significant increase in clotting or changes in the urine output. And let's see. That should be it. Thank you.